I think a really nice mix. So really good to see everybody. And Marie, shall we start? I'll keep on clicking admit to those who are joining.
Yes. Yes, why not? Let's get the show on the road. So thank you all. My name is Marie McGrath. I'm one of the technical directors at ENN and co-chair of the MAMI Global Network, together with Marco at the London School of Hygiene and Tropical Medicine. And we, together with my colleague, Kelsey, who's the MAMI Global Network coordinator. So welcome all. As I say, we're just muting and turning off videos on everyone. Just so that we can preserve the bandwidth for everyone. We are going to have this webinar in two parts. So we'll have first a short presentation of about 20 minutes or so, and then about 40 minutes of questions and discussion with you all. We'll then move into a second part where we'll have a shorter presentation, which goes into a bit more details into the package itself and the resources available within that. And again, we'll have about a 40-minute conversation stemming out of that, and then we'll close. The video of this webinar and the actual presentations themselves will be available shortly afterwards on our MAMI YouTube channel that you can navigate through the MAMI website at the ENN, but we'll share all those links as we close the meeting. When it comes to the plenary and the discussion session, our colleague at ENN, Gwen, is going to monitor the chat. So please, as you're listening, pop any questions that you have into the chat box. We'll answer them directly as much as possible as we go through the session, but also then we'll pick some up to address in the discussion session we have. And we'll also invite some of you to actually share comments and questions or suggestions directly. So when we do that, we'll ask you to unmute and share your video. And then once you're finished talking, you can mute and hide yourself again. But we'll describe that as we get closer to the session of discussion itself. Any questions that we don't manage to get to, we'll collate and address, and then we'll share with you all as follow-up to the meeting. So I think that is all the general housekeeping, and just again, a warm welcome to you all. And before we start the first presentation, I'll just hand over to my colleague, Marco, just to say a few words of welcome too.
Great, thank you very much, Marie. And I also want to echo a big thanks to all of you for joining today to share and to hear more and to give your feedback to what we've done so far. I want to also echo a big thanks to our funders who made all of this possible, both now, previous versions. So this is exciting because it's now version 3 of the Care Pathway, and really hope that you'll enjoy the big step that it's taken since then. And big thanks especially to also the many of you, and great to see so many online, who contributed to this pathway and contributed lots of thinking about this field in the past, in this present iteration. And just to say, really looking forward to working with everybody over coming months, over coming years, to really make it a reality on the ground, because that's the one thing that really excites us. It's not about the technical guidelines, it's not about the writing papers or reports, it's actually what happens on the front line. And I think that's where I'm really excited about the MAMI Care Pathway. I think where lots of you have joined us on it, it's about seeing things translate from high-level policy into frontline action. And I think that's where it really counts. I think there's lots of focus on the interventions, on getting some of the details and the technical details right. But essentially, we want this to translate into impact on the front line. So really exciting to be moving on to this next stage. Hope you like what we've done so far. And we really look forward to working with everybody to make it a reality on the front line and to take it to the next steps. So thank you all for joining.
Thank you, Marco. And so without any further ado, I'm going to ask my colleague Megan to launch the first presentation.
This presentation will give an overview of the MAMI Care Pathway Package. MAMI stands for the Management of Small and Nutritionally At-Risk Infants under 6 months and their mothers. Let's start by understanding why the MAMI Care Pathway Package is needed. Nearly half of all child deaths are due to undernutrition, and infants under 6 months are the most vulnerable. About 1 in 5 infants under 6 months is small and nutritionally at risk. These infants are at higher risk of sickness, death, and poor development. They may be born small and at risk, such as low birth weight and preterm infants, or may develop nutritional risk after birth. They might be wasted, stunted, or underweight. Despite the millions of infants and their mothers in this situation worldwide, many don't get the care that they need to survive and thrive. This is because there is a serious gap in care for these infants and their mothers, especially in community services and after the newborn period. Immediately after birth, infants and mothers are supported in newborn and early postnatal care services. But after discharge, there is little support available to them if they're small and nutritionally at risk. Routine IYCF counseling isn't sufficient to meet their complex needs. And if they become malnourished, the only option in most settings is inpatient treatment, but families often struggle to access this care. Many of these infants are clinically stable and could be managed in outpatient care that's more accessible for families, but it's rarely available. This means that small and at-risk infants are left waiting until they reach 6 months of age and meet admission criteria for wasting treatment programs for older children. We must do better. We're missing opportunities to support at-risk infants and mothers in this critical period. This leaves fragile infants and their mothers vulnerable during one of the most challenging periods in life. Let's look at an example of why MAMI is needed. Imagine 4-month-old Zala and her mother Ida. Zala was born with tongue tie, a common condition that can make it difficult to breastfeed. Ida struggled to breastfeed Zala and became anxious as she watched her daughter become thin and fail to grow. She attended IYCF counseling at the local health center and received advice on breastfeeding, but Zala wasn't checked for tongue tie, and breastfeeding continued to be a struggle. Ida decided to stop breastfeeding and give Zala formula because she was worried about how thin she had become. The formula was expensive and the family struggled to afford it, but they saw no other way. Soon, Zala developed diarrhea and the family took her to the health center for treatment. The costs of getting to the health center and medication were a burden on the family. They were told that they must boil all water used to prepare formula at each feed, but struggled to do this because fuel is expensive. Zala remained small and thin, so Ida decided that she needed other foods and began to feed her a thin porridge. Zala failed to gain enough weight and was frequently ill. At 6 months of age, Zala was admitted for wasting treatment at the local health center. Ida continued to suffer from anxiety, but no one noticed or offered her support. Look at where the missed opportunity to identify and treat a simple condition has taken Ida and Zala and their family. Experiencing malnutrition in the first 6 months of life has the potential to negatively impact Zala for the rest of her life. In the short term, she continues to be at high risk of illness and death. In the medium term, the effects of malnutrition on her development might affect her capacity to learn in school and earn a living later in life. There's also growing evidence that she might be at increased risk of non-communicable diseases in the long term. All of these effects have serious consequences, not only for Zala, but also for her children and for wider society. To bring attention to this problem and to improve care, the MAMI Global Network was formed. The MAMI Global Network involves local, national, and international collaborators working together to improve policy, evidence, and practice for small and nutritionally at-risk infants under 6 months and their mothers. Our shared vision is that every small and nutritionally at-risk infant under 6 months and their mother is supported to survive and thrive. Our ultimate goal is to build strong infants, strong mothers, and strong futures to help achieve the 2030 Sustainable Development Goals. To put this vision into action and to help fill this critical gap in care for vulnerable infants under 6 months and their mothers, the MAMI Global Network has developed the MAMI Care Pathway Package released in May 2021. Previously known as the C-MAMI Tool, the update was informed by the latest evidence and experiences of putting previous versions into practice. The MAMI Care Pathway Package is a package of resources that was co-created by members of the MAMI Global Network, co-led by the Emergency Nutrition Network and the London School of Hygiene and Tropical Medicine. It provides guidance on how to screen, assess, and support small and nutritionally at-risk infants under 6 months and their mothers, and materials to help practitioners put this into practice. Its development was guided by the AGREE reporting checklist, which aims to improve the quality of clinical practice guidelines. The package is not intended as an off-the-shelf intervention. It requires adaptation for different contexts, depending on what the needs are, what already exists, and local resources. Let's take a look at the guiding principles of the MAMI Care Pathway Package. One of its most important features is that it bridges interventions and links with and uses existing systems and services. We know that nutrition problems are about more than feeding alone, so the MAMI Care Pathway connects nutrition, clinical, and social interventions to provide more holistic care for at-risk infants and their mothers. The MAMI Care Pathway always considers the infant and mother together, because we know that infant well-being is inextricably linked with the well-being of the mother. It helps put the 2013 World Health Organization guidelines for the management of severe malnutrition into practice. And it's designed to embed within integrated management of childhood illness, or IMCI, an established approach to child health implemented by families, communities, and health facilities. The package is based on an integrated care pathway approach that considers the processes, resources, and participation needed to support infants and mothers from initial screening through to exit from care. Finally, the MAMI Care Pathway Package is relevant across development and humanitarian settings and different contexts. So how does the MAMI Care Pathway work to support the care of at-risk infants under 6 months and their mothers? A key principle of the approach is to assess and support infants and their mothers at every community and health service contact point. There are many opportunities after birth to identify small and nutritionally at-risk infants and offer support. For example, infants who are recorded as low birth weight can be identified for community follow-up. Or infants attending for vaccinations come into contact with health services several times before 6 months of age. Infants might also present to health services with minor illnesses. It's important to take these opportunities to identify at-risk infants and mothers, to provide or refer for appropriate support, and to monitor their progress. Remember the case of Ida and Zala. If they had been assessed and received targeted support, imagine how different their story could have been. To change their story and the story of millions of infants and mothers just like them, the MAMI Care Pathway provides a simple framework to ensure that at-risk infants under 6 months and their mothers are identified, assessed, and supported across health systems and services. So what are the benefits of using the MAMI Care Pathway Package? First and foremost, it benefits small and nutritionally at-risk infants under 6 months and their mothers by improving the quality of care that they receive, helping them to survive and thrive. Improving the health and nutrition of infants under 6 months has short and long-term benefits for these infants and for their families and for wider society. Carers and families benefit from an approach that aims to increase user satisfaction with health services and recognizes the importance of caring for the health and well-being of the mother as well as the infant. The MAMI Care Pathway also benefits frontline healthcare workers by simplifying the care of infants under 6 months and their mothers. Importantly, it aims to reduce patient workload by allowing health workers to identify and focus on the infants and mothers with the highest needs. It recognizes that supervision and referral services can be limited and that isolated health workers need a simple how-to guide. It increases job satisfaction by offering easy-to-follow guides and solutions to deal with complex problems. This helps to ensure that serious underlying conditions are not missed, a situation that can create stress for health workers. The MAMI Care Pathway also offers a way to improve communication and collaboration with colleagues in other related health and social services. For service managers, the MAMI Care Pathway provides a ready-made suite of materials and resources to help implement improved care for infants under 6 months and their mothers. It also makes it easier to audit programs and monitor performance. Policymakers and researchers can also benefit. The package translates existing policies for frontline field use, helps generate evidence that's needed for future scale-up, and bridges existing services, especially health and nutrition. Let's look more closely at where the MAMI Care Pathway fits in the wider health system. It fits in at the community, primary, secondary, and tertiary levels of healthcare. The core MAMI Care Pathway activities fall in the early postnatal and the 6 weeks to 6 months age periods. At tertiary level, if an infant is born small and at risk or admitted with a complication, they can be managed in line with the MAMI Care Pathway. At secondary and primary level, they can be identified and supported in outpatient MAMI care. And at community level, screening can be used to identify at-risk infants and mothers as part of community services like growth monitoring and IYCF, and then referred for assessment at primary level facilities. We should also look to identify at-risk infants at an earlier stage by building links with antenatal care and birth services. For example, multiple pregnancies are at higher risk, so this is an opportunity to link with MAMI services for ongoing support once these babies are born. These linkages can also be established at community level. For example, referral of small and sick newborn infants for community-based MAMI support after discharge from inpatient care is another opportunity to safeguard these at-risk infants and their mothers. Let's look at an overview of the MAMI Care Pathway Package. The MAMI Care Pathway has 3 key stages: screening, assessment, and support and management. Each stage is supported by user guides and forms for frontline health workers. We'll look at these materials in detail in the second part of this webinar. There are many initiatives and strategies across nutrition and health with which we share a common vision and principles and support delivery of actions. For example, the MAMI Care Pathway supports the UN Global Action Plan on child wasting to accelerate progress in preventing and managing child wasting. It's consistent with the Every Woman, Every Child Global Strategy for 2016 to 2030, which advocates for collective action to support infants and mothers to survive and thrive and to transform their care. It also upholds the vision of the Every Newborn Action Plan to reduce mortality and secure the best start in early life. Through the MAMI Care Pathway, we can support continuity of care with neonatal services for infants born at highest risk. Consistent with the Small and Sick Newborns Initiative, we can help small and sick newborns survive and thrive through quality healthcare in the community with the mother-infant pair at its center. We also share the vision of the Nurturing Care for Early Childhood Development framework to help children survive and thrive to transform health and human potential. The MAMI Care Pathway Package targets nurturing care to at-risk infants for whom support for development is especially critical. One frequently asked question about the MAMI Care Pathway Package is how it fits with other related approaches such as IYCF and IMCI. It provides specialized IYCF counseling tailored to the individual mother-infant pair, while IYCF programs provide more general support. It refers directly to IMCI for clinical assessment, analysis, and action, and embeds the IMCI approach within the materials, providing further depth to MAMI components of care, such as feeding support, maternal mental health, nurturing care, and infant sleep. The MAMI Care Pathway brings together key elements from other approaches too, such as nurturing care for early childhood development and maternal mental health. The package can also be used for outpatient and inpatient care. By bringing these elements together in a coherent whole, the MAMI Care Pathway helps unify these complementary approaches and encourages continuity and consistency of care. In summary, the MAMI Care Pathway Package is an integrated care pathway approach to the care of small and nutritionally at-risk infants under 6 months of age and their mothers. We consider not only the infant, but also the mother and wider society. MAMI is about bridging hospital and community care. It links nutrition and health and disability. MAMI considers not only weight and growth, but also function and health. And though mainly intended for low and middle income settings, MAMI is also relevant to high income countries. MAMI efforts are at an exciting stage on our path to scale up, and we all need to join forces in our collective effort. It's critical that we build evidence from implementation of what works and how in different settings. You can download the MAMI Care Pathway Package at ennonline.net/MAMI Care Pathway. We'll use your learning to shape future versions of the MAMI Care Pathway Package, so please share your experiences and questions. You can join the MAMI Global Network by contacting the MAMI Global Network coordinator at mami@ennonline.net. You can post any questions on the dedicated MAMI area of ENN's online technical forum and net. And for more information on the MAMI Global Network and how we work across evidence, policy, and practice, please visit our website. We would like to acknowledge our funders, the Eleanor Crook Foundation, Irish Aid, and the Waterloo Foundation for their generous support. And many thanks to the members of the MAMI Global Network who are responsible for an immense collective action to develop the MAMI Care Pathway Package. Thank you for listening, and we now welcome any questions and discussion.
Thank you, Kelsey. So really, it's over to you now. I see a couple of questions came in our chat box, but really we'd open our session now to any questions, observations, comments, suggestions that you may have in terms of understanding. And indeed, I see a hand up from Zulfi Boucher. So Zulfi, we'd welcome you to unmute yourself and even switch on your video, and we'd be delighted to hear from you.
So thank you very much. It's absolutely fantastic what's been achieved. One big question that I think needs to be addressed, and it may be there in the details but not explicit, is how will the MAMI Care Pathway link to the work that's already been done or is underway on identifying at-risk vulnerable newborn babies based on any phenotypic classifications? In other words, will we be able to triage using this pathway babies who are small for gestational age, and hence there is some pre-birth identification, preterm, or a combination thereof? And I'm particularly referring to those who are both preterm and small and with the highest risk of adverse outcome. Would this care pathway be able to triage those babies from the very beginning to extra care, and hence make a seamless process between, let's say, fetal growth, maternal care, newborn, and child care?
That's a wonderful question.
Yeah.
And Marco, do you want to start off?
Yeah, thanks very much. And I think, again, big thanks for joining. I think that's such an important point, and that's what lots of the work that we're doing is looking at, is how to identify those who are higher risk. So we're not treating numbers, we're not treating anthropometry for the sake of treating it, we're really looking for high risk children. So in the current care pathway, low birth weight is explicitly there as an independent criterion for admission. But what we hope is that through using this, through collecting better data, we'll be able to refine and to fine tune those exact admission criteria as time goes on. So we urge people to collect that data so that future secondary analysis can inform that very question. So we're also contributing to discussions around the current WHO guidelines, so how to refine those indicators for identifying high risk, both anthropometric, but also adding in those other things like the history of prematurity, intrauterine growth retardation, but also I think we really want to try and flag up other key things like breastfeeding, because we're very conscious that an infant, for example, who may, or two infants who have exactly the same anthropometry, the one who's breastfed may be much more protected, more buffered than one who isn't. So I think, yeah, a really key point. We haven't got definitive answers, but we really welcome working with everybody to work together for those as time goes on. Thank you.
And I think, and just to add to that, I think really what this is about is really connecting those referrals and linkages. And so that if you have a service where you have had a small and sick newborn, or you've had a premature infant, what happens to them after 6 weeks of age? This is where we need these connections between systems and services so that there is follow through. Many programs in high burden settings cannot identify at 6 weeks of age whether a baby was low birth weight or premature, and we find that some indicators like weight for age will capture those infants. But if we've got communication and connection with services that can direct these infants into systems of support in the community, so that the support doesn't just finish when they're 6 weeks of age, but then it continues on. We know they're at risk, they need their support. And that's really where it's about integrating and connecting the systems and services, and that we talk with each other and we manage a framework. And this MAMI Care Pathway gives us a framework to try and engage that.
Yeah, and maybe just to follow up, I think another key principle is that we want to try and be involved in prevention as well as treatment. So lots of high risk doesn't come as a surprise. So even though that this phase is currently focused on what happens postnatally, that a future phase, the next phase, will very much consider antenatal risk. So for example, multiple births, high risk pregnancies, we hope that those mothers would be identified early, would be given enhanced antenatal care. And we know that yourself and many others are working on those antenatal care packages. I think there's a big opportunity to link so that we don't suddenly end up with a child who's wasted or stunted at 6 months and beyond. So there's a very strong preventative component here as well. But thank you for raising that.
And I just see there's messages coming in on the chat as well, just adding to this and just saying how critically it is to in terms of linking in with fetal growth, and also at 6 weeks is too late. We absolutely agree that this is about integrating systems of targeted support for mothers and infants from the get-go, getting in as early prevention and then getting in as early as possible, and really looking at the opportunities to do that, which will vary greatly by system, by service, by context.
Yeah. Marie, should we address some of the other questions? So
Yep.
Roxana, again, great to see you. And you make a really good point about, even 6 weeks of age is too late, and absolutely. And I think that's why one of the key contact points and the key recruitment opportunity is at birth. So when infants are born, if they're low birth weight, if they're preterm, if there's any other opportunity then. And one of the other areas that we also specifically flag in terms of potential for recruitment and potential identification is that early visit. So at a week or 2 weeks of age, for those infants who haven't regained their birth weight or who are struggling early on. Because you're absolutely right. Waiting for them to struggle for a long time is too late. And we believe that the greatest opportunity to make an impact is identifying as early as possible. So really important.
Another question that's come in, where do you think nutritionists can be of best support in the MAMI Care Pathway? I think a critical element of the MAMI Care Pathway, and why I think it resonates very much with across health and nutrition initiatives and strategies, where what it does is bring some depth to the type of support that is needed around feeding support for infants. So within the resource materials themselves, we'll see in the second presentation, they're very specifically looking at what are the particular problems or challenges a mother-infant diet are facing, and what is the specific skills support that is needed in that regard. So really it is about strengthening the dimension of nutrition support that is provided to small and nutritionally at-risk infants, where the complexities may be significant and maybe multiple too. So I really think it is about really strengthening that component, where often we describe this is what we want to do, but we really, the tools, the frontline workers don't actually have the tools in order to be able to deliver on that. And hopefully this is really going to help in that regard.
And I see also a question from Pat about fetal growth, and can we identify or can we predict MAMI infants, looking at maternal status. So that's, again, that's a really important next step. So in a review that we did in preparation for a WHO meeting in 2019, we looked at risk factors associated with wasting and underweight in infants under 6 months, and maternal stunting. So being, I think it was below 145 centimeters, was a strong predictor there. In the DHS surveys that we examined, there weren't other indicators of, or there was maternal BMI, and having a low maternal BMI was also a factor there. MUAC, of course, you'll know, is a good way of assessing status in pregnancy because of the difficulties in interpreting BMI, and I think more work is needed on that, on quick, easy ways. And again, it's about that link, that there are clear risks antenatally, that thanks to the antenatal, the obstetric community, who've done lots of fantastic work supporting and building up antenatal services. There's lots that already happens there, but as time goes on, we'd also really like to make more links and open up more conversations with that community so that we can look for MAMI specific risk factors which perhaps don't receive in all settings as much attention as they might in future. So looking at maternal nutritional status is important. There's a whole separate discussion and research agenda for what to do in those situations, about what kind of supplementation. Clearly, there's a very strong case for micronutrients at the moment, but what role macronutrient supplementation has. And perhaps, Professor Butter, I know that you've done some reviews on antenatal interventions. So perhaps if you have a moment to comment on that, or others can also feedback, but definitely a role for antenatal care as well.
Absolutely. And as you rightly pointed out, some of the interests that one has in antenatal nutrition interventions is around pathways to influence fetal growth, but also growth in infancy, early infancy in particular. So with both multiple micronutrients, and especially now with these lipid supplements, some of the effects that are being observed are on precisely fetal growth that impacts on our current assessment methodologies of at-risk children, either by linear growth retardation or by wasting in the first year of life. But I wanted to raise one point and just leave it there for the moment, because this is such a fascinating and an important area of work. There is work underway, as you know, Marco, on identifying the link between fetal growth trajectories, at-risk subgroups of infants, the phenotypes that I was referring to, and both metabolomic and additional studies in pregnancy that help identify what pathways may be needed for restitution, rehabilitation. And it may not only be nutrition, it could also be the interface of infection control, management, and nutrition. And the same is being extended now to the first 6 to 12 months of life. So I look upon a lot of research opportunity as we move forward in not only linking clinical management, but also understanding mechanisms. I mean, should we be doing something different than just pure nutritional rehab in these children, or should we be addressing, in some circumstances, the high burden, concomitant burden of inflammation, which is not an substantial issue, particularly when it relates to things like enteropathy.
No, thank you. No, I think that's a really important point. And I think that's why when developing this MAMI Care Pathway, our big focus is not making it just about nutrition. So nutrition is our central point, and breastfeeding support is really critical because that has all kinds of positive impacts on the microbiome, on inflammation, etc. But it's not just about nutrition. It's about addressing, identifying and tackling wider health issues and building those bridges into the other services. And so, one of those, for example, not to do with inflammation, but another really key bridge. And big thanks to our mental health working group, who developed a very, very persuasive and good part of this package, is looking at maternal mental health, which has all kinds of impact on not just nutrition, but on infant care. And that's an important thing. So Jonathan Wells and Mary Fetal at the UCL, for example, have been doing some really interesting pioneering work on maternal relaxation, and have been finding in a number of studies that it both increases breast milk supply, reduces cortisol that's transferred over to the infant, as well as being an inherent good thing for the mother. So simple things like relaxation feel a part of the role, play part in this package. And that's why you'll see that as one of the interventions. So I think, if there's one message to take home from this, it's don't think about MAMI as just nutrition. Nutrition is part of it, but we're about building bridges to a number of different services, making links, I think working together, from that basic science that you so rightly raised, from thinking about the mechanisms to thinking about the implementation and what actually happens at the point of delivery.
Mm-hmm. I see another important point is raised about assessment in the chat box. From Gudrun saying feeling supportive step would be to assess 0 to 5-month-olds in nutrition surveys on a routine basis, because then it brings greater visibility, more recommendations for strengths and activities. And what's our take on this? I heartily agree. And I think we were caught between that conundrum we often found where those conducting surveys didn't want to start looking for them, because then what do they do when they find those infants, and unsure how to manage them, and also people are not sure about how the methodology as well in order how to include them in surveys. And I think this is really why we developed the MAMI Care Pathway when it was originally the C-MAMI Tool in the first place, saying there isn't a vacuum. There is a lot that we can draw upon. And I think really having the MAMI Care Pathway Package now in its current configuration means that there is something we can do. And we need to start looking for these infants. We need to start getting very context-specific national and subnational data on what the burden is in your particular context, what are the needs there, and then crafting the MAMI Care Pathway and making it your own to adapt it to your situation and to your circumstance. But I really do agree with our contributor on the chat box that we do really need to be getting visibility and harmonized, strong data collection so that we can actually see what we're talking about, is raise visibility, because I think this has for long been a hidden problem and we have to give voice to it.
Yeah. So just looking at the chat box, and again, Pat, you raise another important point about integrating it with C-MAM. That's a really good point, but I think a key thing is that what we don't want to integrate, this is not just part of C-MAM. I think our vision is that this should be a lot more integrated within general child health, because as you'll know, that one of the great successes of C-MAM is that it was quite a vertical approach in humanitarian settings, and that's why it scaled up and was very quick in the beginning. But that's one of the big challenges for C-MAM now, is that it is still in many settings fairly standalone, fairly vertical. So if a child comes for treatment of their diarrhea or their pneumonia or their fever, they're not always linked in with a C-MAM service, with a wider service. And so that's why our principle is to link in a lot more with the general child health services, rather than just be a subset of C-MAM, rather than be standalone. So it's those wider services that we really want to link in. And it's again that metaphor of building bridges. So it's not, so C-MAM could be one route in for younger children, but we really want any contact points to be an opportunity to assess the nutritional status and then to act accordingly. So other links, for example, as you'll see in the next section, or as we covered just now, are, for example, when infants come for immunization visit, that's a really key opportunity to assess the anthropometry, to ask a few questions about feeding, to ask how mother is. If mother is in a care service, if she's accessing any healthcare, that's an opportunity for MAMI. If the infant is coming for any other contact with a community healthcare worker, that's an opportunity to assess. So it's about building bridges with many different services, not just C-MAM.
Yeah. And I see we probably just got a minute or two more on this discussion. We'll have plenty and more opportunity after the next session, but I think just to really pick up on that point, and again, a contribution, thank you so much, in the chat box about for the small and sick newborns. Leah says that intervention and follow-up of high-risk infants should begin prior to hospital discharge. Does MAMI have linkages at pre-discharge level? Absolutely, yes. And this is really about making those links happen. That's what we need to be doing. We need to be creating those linkages. And this is why the MAMI Care Pathway, as we said, isn't a vertical intervention. It's not a standalone. It's about leveraging what exists and how the implementation models, the delivery services and systems, and the connections between services needs to be elaborated and figured at country level, at intervention level, at service level. Absolutely. Those sort of linkages are key if we're going to have a continuity of care and a pathway of care for infants under 6 months. And so I think we have an out session. Again, just encourage everybody to go on mute. I think we've got a little bit of interference in the background. So if everyone could go on mute, I'll ask, I'm going to ask Megan in a moment to share the slides. But before I do, we thought it would be nice if we could try, make an attempt at least to capture everyone's smiling faces on a Friday morning, afternoon or evening, wherever you are in the world. So if everyone could just click on their video, at the risk of us hopefully not getting rid of all the bandwidth that we've enjoyed, and we'll try and take some snapshots of all your smiling faces and we'll compile them and share with you all afterwards. So we'll just give you a moment, and then some whizzes at the IT in the background at ENN will capture some faces and let us know when we're good. How great to see everyone. Let me know when you're done, Megan. I've got 6 pages, so gosh. Yes, done. Fantastic. Thank you all. I'm afraid we'll ask you to hide your faces again. We'll all do the same, but lovely to see you. And over to you, Megan, just to share our next brief, about 10-minute presentation. Into a bit more detail on the MAMI Care Pathway resources themselves.
In this presentation, we'll look in detail at the contents of the MAMI Care Pathway Package. So what does the MAMI Care Pathway involve in practice? There are 3 key phases: screening, assessment, and support and management. Screening is a quick assessment that takes place at any contact point with infants under 6 months and mothers, like vaccination or growth monitoring visits, to cast a wide net for identifying at-risk infants. If a high-risk infant is identified according to IMCI danger signs, they'll be referred for urgent hospital care. Most infants who are screened will have no problems and will be referred for routine healthcare and IYCF counseling. If a potential risk is identified at screening, then the infant and mother are referred for a more in-depth assessment by someone who has more specialized MAMI training. At this in-depth assessment, they're classified into one of 3 situations. They might be identified as low risk and be referred to routine healthcare and IYCF counseling. They might be identified as high risk and need referral to hospital or inpatient care. Or they may be moderate risk and can be safely treated in an outpatient or community setting. If a low-risk infant attending routine healthcare later develops issues, they can be referred for MAMI assessment at any time. The focus of MAMI care is those infants who are at higher risk than the general infant population, but medically stable. These are the infants who are enrolled in outpatient MAMI care until 6 months of age. The frequency of follow-up during enrollment will depend on what is right for the individual mother-infant pair, decreasing or increasing frequency as needed. At 6 months of age, infants and mothers have an outcome review and are either deemed recovered or referred on for continued support in relevant services. Let's look at what's involved in MAMI assessment and management. In summary, it starts with rapid screening followed by assessment if risk is identified. Assessment begins with a check for IMCI danger signs, followed by a check for any further health issues, feeding assessment, maternal mental health assessment, and a check for other key risk factors. The issues identified at assessment will help determine a management plan and the support the mother and infant need. If the mother or infant is high risk or a complicated case, then they go to inpatient care for clinical stabilization. Once stable, MAMI-specific support can also start there, for example, through tailored feeding support and maternal mental health support. Most infants at this point of the pathway will be moderate risk and medically stable and can be safely treated as outpatients. The core of MAMI support is tailored support and counseling focused on issues identified at assessment, for example, infant feeding problems and maternal mental health concerns. There are also core counseling topics relevant to all infants and mothers, including relaxation, crying and sleep issues, nurturing care, family and community support, and complementary feeding for when the infant reaches 6 months of age. Referrals are made to other services as needed and where available, and mother-infant pairs are enrolled until 6 months of age. Finally, infants may be referred from inpatient care for further support as outpatients, and infants who develop complications while in outpatient care should be referred for inpatient care. Let's now look in detail at the contents of the MAMI Care Pathway Package. There are 3 core materials in the package: user guides, which can serve as training materials or references and are formatted in the IMCI style, forms to gather patient data, and counseling cards and support actions booklet to facilitate assessment and management by frontline health workers. These materials will likely require adaptation to different contexts, and they're all available online at ennonline.net/MAMI Care Pathway. As we see here, each stage in the pathway is supported by different materials. We'll now look at the materials available at each stage of the pathway. MAMI Rapid Screening is supported by the MAMI Rapid Screening Guide, which outlines the assessment, signs of risk, classification, and management actions for infants and mothers who are screened at various healthcare contact points. MAMI Assessment is supported by the MAMI Assessment Guide and several forms. There's the core MAMI assessment form. It includes screening questions for feeding risks and maternal mental health concerns. If these screenings identify a risk, then there are supporting forms to assess feeding and mental health. The MAMI assessment form leads to an overall classification of the infant and mother into one of 3 options: inpatient care for high-risk issues, outpatient care for moderate risk issues, and routine healthcare and IYCF counseling for those at low risk. MAMI outpatient support and management are supported by the MAMI enrollment and follow-up form and a set of counseling cards with accompanying support actions. The MAMI enrollment and follow-up form helps the health worker to monitor the infant and mother's progress during their time in MAMI outpatient care. It includes space for notes and a decision-making aid to decide on the frequency of follow-up. It also contains a guide to the outcome review at 6 months of age that helps to classify the pair's status and make appropriate referrals for continued care. The MAMI counseling cards and support actions booklet are largely based on the UNICEF IYCF counseling cards that draw upon WHO resources and experts with MAMI-specific additions. They contain images and counseling information on infant feeding, relaxation techniques, crying and sleep, and nurturing care, among other topics. They're designed to have imagery on the front of the card to show the mother and written guidance on the back of the card, which the health worker can refer to during a consultation. Implementers can use or adapt these cards for a given context or use existing cards and incorporate the MAMI-specific additions. As we've said, the MAMI Care Pathway Package is not a standalone or off-the-shelf intervention. Adapting the MAMI Care Pathway to fit with, link, and support existing services is an essential planning step. A feasibility check of the MAMI Care Pathway should examine the demand, acceptability, and practicality of implementation with service providers, health staff, and if possible, families. There may be different levels of adaptations needed in different settings. In some settings, the tools might be adopted more or less as is, with just translation to local language or substituting local images. In other settings, there might be minor or more major adaptations needed, such as changes to admission criteria. We can imagine this as different cars for different roads. The MAMI Care Pathway provides the engine to drive the process forward, but different features are needed in different contexts to make the MAMI Care Pathway effective and appropriate in the local setting. It's important to document these adaptations and the reasons for these changes to help build evidence and to inform how we compare different implementation models. As we said earlier, please share your experiences and questions with the MAMI Global Network. The MAMI Care Pathway Package is available online at ennonline.net/MAMI Care Pathway. You can join the MAMI Global Network by contacting the MAMI Global Network coordinator at mami@ennonline.net. You can post questions on the dedicated MAMI area of ENN's online technical forum, ENNet. And for more information on the MAMI Global Network and how we work across evidence, policy, and practice, please visit our website. We would like to acknowledge our funders, the Eleanor Crook Foundation, Irish Aid, and the Waterloo Foundation for their generous support. And many thanks to the members of the MAMI Global Network who coordinated to the development of the MAMI Care Pathway Package. Thank you for listening, and we now welcome any questions and discussion.
And so we're back together again. So again, open for any questions, suggestions, and discussion. I see a few people have to pop out, some to get their second shot of a COVID vaccine. So I think we really don't want to hold back on that front. So please go with haste, and you can catch up with us later on our YouTube video. But thank you so much for fitting it in. And I can see a couple of hands and comments coming in. So I think Arthur, I think you've raised your hand. Would you like to unmute and share your video and pose your question, or indeed share your observation? Perhaps he's disappeared. We can return to that, and just looking at the questions again. I think people have been sharing their experiences of the need for early intervention online, and thank you all for actually contributing to each other's questions. And I think this is the beauty of this forum and this collective, and how we really work and want to nurture our ways of working by sharing with each other our experiences and lessons as well. None of us have the answer, but together we will develop and figure out the answers. So please do continue to contribute to each other and connect in the chat box, as well as asking questions to us directly. And I see there's a question about how many countries have started the MAMI intervention, and if a country is interested, will there be technical support available? That's a very good question. So there's sort of small scale interventions in different shapes and forms around MAMI happening in several countries that have been over the last couple of years. So for example, in Rwanda, in Bangladesh, in Ethiopia, and many more prospects. And on our website, we have a Google map, which is sort of tracking who's doing what and where, and which is managed by Save the Children as part of the MAMI Global Network. So have a look at that. We'll share the link with that shortly in the chat box, so you can have a look at that. And I think in terms of technical support, we'd really encourage you to reach out and join the MAMI Global Network. Within that, we have an implementers working group. So that's a means for those considering or implementing in whatever form or shape that might take, can connect with each other. We meet monthly. And then we also have the ENN online forum, which is an online technical forum that is managed by ENN, and there's a dedicated MAMI thematic area there, so you can pose questions as well. And we have some expert moderators, but also we know we have very expert peers and moderators around the world, so anybody can contribute a question, but also contribute to developing the answers. So I would suggest both ENN, joining our MAMI ENN online .net. If you contact there, you can join the MAMI Global Network, and then you may want to directly get involved in the depth that the implementers working group is able to do that. I think, again, another very good question is there ongoing work to support countries to accommodate MAMI in national policies and guidelines to ensure adoption and rollout? I think this is a very critical one. I think we have recently completed a review of signs on wasting treatment, and only 5 or so included infants under 6 months in a community-based management. So support to national guideline updates is quite critical. At a global level, we're involved in the normative guideline development with WHO, and a critical thing is then how we encourage and support the take of guidelines at country level. And this is an area of action that we're going to be taking on within the MAMI Global Network, and we shortly will be releasing our 5-year strategy, which reflects that as a key action area.
Yeah, thank you. And just that there have been a couple of comments as well about monitoring criteria. So that's something which is a work in progress, but it's a really good point because there's a big need to try and standardize the kind of data we're collecting. And I think
Marco, I think we've lost your sound.
Oops.
Oh, there we go.
Sorry. Yeah, so on the issue of monitoring and key admission discharge criteria, so a few people have been asking about that, but that's a work in progress. The WHO are fine-tuning the details of what the case definition will be, both for entry and exit criteria. We're also doing a survey with that, so led by Ellie, who's one of our excellent MSc students. So I've just put the link in that because we're going for the term small and nutritionally at risk, and a reason for that is to try and harmonize with the small and sick terminology that others in the neonatal field are using. Again, it's to highlight that issue around birth weight, about the in utero risk, and also to highlight that the core of our intervention, though not all of it, is focused on breastfeeding and nutrition. But there are some questions about admission discharge criteria. So we have a survey on that. And so do please let us know your thoughts about what could be the optimal terminology, etc. Because in terms of, if you're wondering where the acronym comes from, back when we started this in 2008, it actually stood for Management of Acute Malnutrition in Infants. And we quickly realized over the initial years even, that this wasn't an acute problem. So sometimes it was, but a large number of infants actually had other underlying problems. So that's why we've moved away from the acute malnutrition terminology. And that's why it's now the small and nutritionally at risk. But we'd love to hear more of your views on how to best move forward with that. And so with the current criteria, you can see those in the paper, in the guidelines. But again, do join us in some of the implementers discussion, because the details of those will depend on setting to setting. At the moment, lots of countries still focus on low weight for length, but it's certainly my interpretation that that's a criteria which is very difficult to measure. It's often not measured, and even when it is measured, it's very poor at identifying high risk. So that's a criterion which is on its way out, but that's in favor of weight for age, which is already widely used, for example, in growth monitoring programs. But yeah, that's an example of the kind of issue which needs to be discussed when thinking about this program in a local setting. But yeah, get in touch with us and be delighted to discuss over during those implementer group meetings.
Yeah. I think there's a really interesting raised by Altrina on the chat box, how this is a valuable tool for working with improving quality service delivery. What about pre-service training, and is there a way to use some of the tools in training health professionals at pre-service level?
I'm not sure, is that Marie who's frozen or myself?
I think Marie has been frozen.
Marie,
Yeah, we can
okay,
hear
so
her.
maybe to pick up on that question.
Marco, I have one question.
Yeah.
actually sharing. It's not a question.
Wonderful. Go for it.
Yeah, I'm from Bangladesh. I would like to share one thing that we have already worked with C-MAMI and reached for a lot of under 5 child. But in case of MAMI, there is no available guideline which is adopted by government, even international or any UN agency. They have already worked with C-MAMI program, but not MAMI program. Have any prospect to work with MAMI program in future? Thank you.
Thank you. So really good points. And we hope, we actually did a review of national C-MAMI guidelines last year. So one of our very good students, Magdalena, who led on that, and that's something we're currently writing up, and keep an eye out for that. That should be on our website soon. But even though WHO in 2013 did make, I think, lots and lots of progress and issued some quite strong recommendations, that at national level they haven't been taken up. So in terms of what to do tangibly, I think number one, have a look at WHO 2013, because there's already lots there, and this care pathway is very much inspired and aims to translate those 2013 guidelines into frontline. The big change that you'll see is in the admission criteria, and for that, keep an eye out on the current WHO process, which I think will be reporting sometime towards the end of this year, early next. And so lots of that we're also translating in this MAMI Care Pathway. So I think if people are interested in taking forward the conversations at national level, again, do email us, join us on that implementers group, and we can take that discussion forward. And I think just related to that, regarding the training, so that indeed is a really important next step. And I know that some funders are here online, and this is exactly what we're looking forward to. And this is not a plant question, but we do welcome that question, because that's exactly what we want to do next, is we want to develop the training package to accompany this. Now, at the moment, we've deliberately written it in a way that people can make their own slides, their own training materials. So some of the MAMI materials that you'll see are very much with that training in mind, rather than the day-to-day practice. So when you see the whole lot, always remember it's not nearly as big as it looks on the front line, because lots of it you'll only really do when doing the induction, when people are getting used to what they should be doing. And in the day-to-day work, it'll be much slimmer, much trimmer, much shorter. But yes, there's a big need to develop a more slick, short, harmonized training, and that's what we'd love to do as the next step. So thanks for raising that.
I think Aisha has raised an important question as well, or would be good to hear countries' experiences and how they've integrated MAMI into different existing programs. And that is like special care baby units, IMCI as well. Absolutely. We have documented experiences to date. A lot of this has been NGO supported programs. Increasingly, we wanted to see how this features and integrates within existing systems and services. So really, this is a call out for continuing to share, and we will support that documentation and learning. There is a trial, randomized control trial being planned in Ethiopia towards the end of this year, led by LSHDM with Jimmy University, Goal in Ethiopia, and ENN. And part of it will be trialed in existing health systems and services, and in the coming months there will be a feasibility study looking at how that sort of integrates within the existing systems and services and within IMCI and other national and subnational guidelines and protocols. But really that is fundamental. It really is the delivery system, and how does it work in different settings. And as is so much the case with this MAMI work, it's those implementing is from whom we learn most. So taking it, working with it, trying with it, adapting it, documenting it, and sharing it is how we'll learn.
Yeah, and just so other points coming in, the one about kangaroo care. So yeah, kangaroo care, so that's noted, so that's in the pathway, certainly for the smaller and the younger infants who we anticipate will be a large majority. We'd also recommend kangaroo care as part of this. So again, it's that other bridge. So that's another stepping stone, that's another bridge to another well-established, effective program, which we're trying to enhance and we're trying to support through this. And so again, above all, say it again and again, but think of this as a bridge. It's not a standalone, it's not new, it's not something radically different. What it is trying to do is trying to bring together all those different components to make an effective whole and actually to make it happen.
I think there's a point about terminology. Some like the C-MAMI, and we found that really was confused with C-MAM. And whilst it might resonate with some policymakers and funders, at country level, it didn't. And I think really, we see MAMI and the management of these small and at-risk mothers and infants is really a sort of holistic umbrella that will take many, many different shapes and forms. And there's a risk of it just being associated as a C-MAM type intervention. It really is more broader and it's more connected across health and nutrition, and is located and embedded within existing systems and services, and really bringing depth and adding value to many services that are already happening or should be happening. So I think the MAMI sort of embraces the C-MAM where that's appropriate, but it goes more broader and widely, and as a result is much more inclusive, and really speak to the fact that it's not a vertical approach.
Yeah, I think just to build on that, we've certainly been very inspired by C-MAM in some of our thinking, and so picking up on that, so some of you may have heard the terminology C-MAMI, and that used to stand for community management of at-risk mothers and infants, but we again moved away from that because of the blurring and the confusion with C-MAM. That one of the barriers and one of the challenges that C-MAM services are now facing is how to integrate in healthcare, and so we're very much learned that lesson. And so rather than think about the integration with health much later on, we're actually doing that proactively now from the very beginning. So our primary integration is with IMCI, with General Child Health Services. And again, there are lots of practical reasons for that, but there's also some biological reasons in terms of there are many other things that might be underlying an infant being small and at risk, which are manifest as anthropometric deficit, but are not primarily to do with nutrition. So lots of health problems, both in infant and mother. And that's why we need that link with health to be particularly strong, and why we're really wanting to put a clear gap between this and C-MAM, and not wanting to cause confusion between C-MAMI and C-MAM. But again, yeah, so sorry, just say again, really value your views on that, and so please again do fill in that survey that Ellie's leading on. So if you have comments on the terminology for the group, etc., let us know about that.
And thank you all for again contributing and answering and sharing each other's thoughts and answering each other's questions, and connecting through the chat box as well. Some great exchanges going on. I think another key element, I guess, of the MAMI Care Pathway Package and our approach, and which will be reflected, as I say, in our MAMI Global Network strategy that we'll be sharing soon, is that we really do need to be considering scale up and sustainability and how we get there from the beginning. And so this is why it's so important, and what we've learned from trying to embed waste and treatment for older children in health systems and services, that we really do need to be considering what are the steps and the tasks that are needed to really address the scale up, the potential for scale up from the start. So the focus is not just on what we do it, what we need to include, but how we need to do it. What is the delivery systems and mechanisms that already exist? How do we build and support what is there? And what do we do? And I think also as we try to aim for our SDG targets, which we're not greatly on track for, we really do not need to target effort and resources to those small and nutritionally at-risk infants and their mothers who are at risk. And who are furthest left behind, you could say, and have most to lose, but also have so much to gain with targeted support. So there really is a need for our concerted collective action on this. And the MAMI Care Pathway it provides us with a practical means to catalyse and help what you do. But it doesn't have all the answer, but it starts to provide the engine, as we reflected, in order then you to develop the car that goes with it. And you just need to share with us the details and the models of the car that you develop that help to deliver on MAMI. And I think, yes, somebody else is just saying what the main challenge of the C-MAMI, and would it affect MAMI as well? So I think one of the challenges, I think, you know, I have to say community-based management of acute malnutrition, the approach revolutionized the care, the wasting treatment of infant children over 6 months of age. It improved access, it improved coverage of services. What it has struggled to do is to do so at scale. And there's a real drive, and increasingly it is integrated within existing health systems and services around the world, and in many countries it is part of it, but we're still struggling to see coverage of services and access and to integration. So what we've learned from that is we really do need to be considering those key elements and factors for scale up from the outset, and to work with what exists, because, you know, it's easy to deliver. It's much easier to deliver a vertical program, all singing, all dancing vertical program that shows impact, but really, is it feasible to do at scale? Can it be sustained? Can it be continued? And those are the troublesome factors that we want to address at the beginning, and we want to take those head on in how we plan MAMI Care Pathway approaches.
And we've also got question from Regina about, is there ongoing work to support countries to accommodate MAMI in national policies and guidelines? So yeah, you know, yes, there is. So for example, we're very lucky to have some wonderful colleagues in Ethiopia, in Jimma University, with whom we're working on doing a cluster randomized trial, testing out the care pathway. And again, it's great to hear other colleagues in Ethiopia who are interested in doing likewise. And we hope that this will, I think, like the early days of C-MAM, and one big thing that we can learn from them, that this is a whole suite of approaches. So we hope to see more operational experiences. I think we really do need some formal trials as well. And again, you know, big thanks to Eleanor Crook for funding and supporting the one that we're doing. And you know, we've done our formative work. We've finalized the protocol and hope to start that later this year. But I think this is an area which is tricky and would definitely benefit from some formal trials, as well as the operational experiences. And I think in that, I think a key part of scale is to be working with national authorities, national decision makers, national leaders from the very beginning. And so that's one thing that we're doing in Ethiopia. You know, that others have also contributed, and you know, we've got a good network in a number of different countries. And the details of how that works I think will vary between different settings, but you know, please do get in touch. Let us know what would be helpful, how the wider network may best support, work with you, etc., to do it in your setting. So thank you.
Just again, looking at our questions. And as you see in the chat box, I've just been posting sort of links and materials, and what we'll do is we will compile the questions and answers as we say, but also we can compile a little bits of the various documents and reports and things that really your questions have prompted us to share in the chat box, and so we'll compile those too. All of these will be available on the MAMI website, but also we will actually just include them in what we share out for you, because they'll resonate and have more relevance for you as they've come up through these conversations. So you'll be able to put your hand in them as well. It's always a challenge when you leave the chat box and then you lose everything. So we will compile those.
And the other thing to flag is the ENN function. So where perhaps you know, Kelsey or Marie can share that in the chat box. So that's a fantastic facility where people can ask questions, reply, engage in conversations, which are then there on the website so that others can learn from the experience. So again, the latest question that I can see is Pat's one about the wasting reset solution. So that's one I'm not familiar with. So maybe somebody could say a little bit more about that. But in terms of wider food systems, infants are slightly more buffered than older children from food systems, which is why we've really got to take care of supporting mothers, supporting families. But yes, anything that affects other forms of undernutrition has potential impact on MAMI infants. But just to flag again, this is not just about wasting. That really what we're realizing more and more, and the data's coming out, that weight for age is probably the best criteria for identification. And so that captures large numbers of wasted, but there's not a perfect overlap. I can share one paper that we got recently from Ethiopia. But when people are analysing their data, it'd be great to look at more settings where we're looking at the overlap between different indicators. So what's the overlap between wasting, underweight, stunting, low MUAC, low birth weight, etc., in different settings? Because I think there's every reason to believe that that has some common patterns, but also that the details of that are different between different countries, but even within countries. So it'd be great to see more analyses presenting and looking specifically at that overlap, so we can really understand it in a much broader sense and over a wider range of settings. So thanks for that question. I think it's a really good one. And yes, we should be working on food systems, on those upstream determinants as well as the immediate factors. So point's really well taken. Thank you.
And just to add, Marco, I think our small and nutritionally at risk infants embraces the infants that are wasted, but certainly is not limited to just wasted infants. And our recent analysis we've done on DHS shows about 1/5 of infants under 6 months are either are underweight or wasted or stunted or any combination of the above, and will vary by context. So we embrace that, and I think the ultimate food system is breastfeeding. It's the most immediate and secure food system that we have to hand. So I think in terms of the waste and reset of what's happening around food system summit, and indeed Nutrition for Growth very much has MAMI at its heart, and will be strengthened as a result of that.
Yeah, I think it really just echo that breastfeeding is very, very easily forgotten because it's less tangible. It's not turned out in a factory. Nobody's invented it, and so it can be one of those things that slips by the net, because what matters there is the delivery system. And again, one way of conceptualizing MAMI is, if we're thinking about vaccines, lots of people get excited about the vaccine, but MAMI is actually and we do have this amazing vaccine, which is in the form of breastfeeding. So, and like any other vaccine, it's not 100% protective. It has its role. Not everybody can take it. But what MAMI is the syringe. It's the way that you get and deliver the vaccine. And it's not just the syringe, but it's also the wider system that supports it. It's the vaccination systems, it's the staff, it's providing with the skills to actually deliver it. It's also, the cold chain equivalent. So that there are challenges in that, but we've really got to be thinking about those systems and the processes, not just the product. And so, that's one reason why I think we're excited about this. And we've been doing lots of thinking about learning from other things that have faced similar process issues in the past. And again, really look forward to working with you all as time goes on to how can we make that delivery as good as possible.
I think we're coming nearly to the end. Unfortunately, we could go on forever talking on MAMI, I think, but maybe I'll raise one last question from the chat, an important one from Kirsten, saying, could you speak a bit to the challenges and possible differences between implementing MAMI in humanitarian and versus development settings? That's a really good question. I think really what we're really saying, again, the engine remains the same. The delivery mechanisms might change a little bit. What we found, the MAMI effort and initiative sort of grew out of humanitarian settings. So often the situations faced in crisis can potentiate the challenges faced by mothers and infants. Things can become particularly challenging. You may have disrupted mothers kept apart, having to travel long distances. Systems and services and health systems may be disrupted, staff themselves affected. So it really, really challenges the system and the delivery mechanism, as well as challenging the ability and the capacity of a mother to care for her infant. And so it reinforces and creates additional challenges in that regard. However, it's really, really important that wherever possible, when we respond in humanitarian settings, that we really try and do so in a way that is conducive to strengthening, building and supporting what exists, or what did exist, and getting it back on track and working with existing systems and services. Many humanitarian emergencies and emergency contexts are protracted situations. they go on for 2 years, for 5 years, for 10 years. And so really trying to accommodate and build in capacities that can continue. And this speaks, I think, very much as well to the donor and funder environment, and where short-term funding actually can be counterproductive and doesn't help nurture those systems strengthening. So again, this is a call out to funders and donors, and really for us to be really promoting humanitarian funding and responses that can really have the capacity to support the existing systems and services. So I think, unfortunately, we'll have to sort of draw gently to an end our session. I hope this is going to be the first of many conversations we have with our newfound friends around the world. I think we maybe just to say just a huge thanks to you all for joining in and participating on this Friday, which is always a difficult day as we all close to the end of our weeks and consider what we have to start doing already on Monday. So this really shows a really collective and shared commitment. So thank you so much. A big thanks again to the Alan Crook Foundation, to Irish Aid, and to the Waterloo Foundation, who have supported and continue to support our effort to develop the MAMI Care Pathway, and then actually help us to put it into the action that we all want to see. As I said, we'll collate the questions and the documents and we'll share them all with you. We will also share a recording of this webinar and the individual presentations themselves. And we will also make them available in French also as a voiceover. We'll make those available also as well. So do please share, don't keep them to yourselves, but share them far and wide with your colleagues, with your friends. You may have many questions that have come into mind as you've come, or will come into mind as you go away today. Please do send them to us. You've got you know where we are now, and you know who we are. So please drop us a line. And we encourage you to join the MAMI Global Network. It can be a light lift, and we send out monthly updates, and you can see what you want to get involved with, or you can get more closely and intimately involved in what we do. But this is really about a collective effort. And let this be just what the start of our working together. It's been wonderful to listen and hear all the exchanges happening, and I really do look forward to the new MAMI friendships and the world over that I can see coming out of this, and this may have sparked, where we really have our shared interests and the mutual best interest of mothers and small infants at our very heart. I think we all share that, so let's see what we can do together. Marco, maybe a few words from yourself before we close.
Great. So I just want to echo thanks to everybody, a big thanks to our funders, Alan Crook, Irish Aid, Waterloo, who are the ones who really make all of this possible. And I think a huge thanks to everybody, because there's so many on this call. It's been a pleasure to work with you all over the last years, and look forward to future collaborations. That a lot has changed, and it's really, Marie and I. So we had the pleasure of meeting in person the other day at a first meeting since the start of lockdown. So that we hope that our next MAMI meeting will be in person next year, and look forward to meeting lots of you then, and really look forward to working with you. So lots has changed over the last over 10 years since we started on this. But there's still a lot to do, and especially a lot to do till the SDG targets of 2030. But I think what's exciting about this current phase, it does feel now within reach. It is coming up to that last final push, and there's lots we can do to scale things up to actually make things happen. So thank you all for joining today. Keep in touch. Keep in touch via those, via the network, via the ENN chat function, by the various surveys, and it's really contributing and putting your stamp and your thoughts into moving things to the next level. So thank you very much, and I wish you all a lovely weekend. Those of you who are already on the weekend, colleagues in Bangladesh, again, have a lovely day, rest of weekend, and look forward to working with all of you over coming months and years. Thank you.
Absolutely, and please, I should actually,
Thank you, Marco.
Yes, yeah, enjoy your weekends. And I do think, just to reinforce here, myself and Mark, we've just been the voice of many, many, many voices, and I call out to all of those over the last 10 years have remained so committed. And I'd like to mention agencies like Save the Children and Goal, who really have been instrumental in taking the MAMI ball and running with it, and sharing their experiences, leading the way, and getting us to where we are today. So a particular call out, I think, to our colleagues there who've stuck with it through thick and thin, and I'm excited about the directions we can go. Please do share and fill in the evaluation form, and we've shared the link in chat box, and we'll include it in the email we send to you all. Have a lovely rest of your morning, afternoon and evening, and we look forward to seeing you again, hopefully in person. Bye-bye.
Thank you all.
It was really a good presentation.
Thank
you all.
you.
Take care.
Thank you so much. Bye-bye.
Bye.
J'ai fait relire le scénario 2 parce que